my name is Mark Gilbert. I'm a public health physician and I'm the medical director of clinical prevention services at the BC Centre for Disease Control. I know we have sort of the 20% undiagnosed statistic for Canada, but I think there's probably great regional variation in the undiagnosed infection. I think if you're in urban centers where you have good access to testing services, your undiagnosed percentage is going to be much lower. Or in some populations that are highly engaged in testing, you'll have a much lower percentage, but probably in other areas, particularly outside of urban areas or other populations less engaged in testing, it will be higher. I think the reason why we have undiagnosed infections are because there still are multiple barriers to testing, and they're sort of pervasive throughout the country. And there are different barriers in different settings. And really, I think there isn't a one-size-fits-all approach to figuring out how we can improve testing access, but really have to take a careful look at the barriers locally in your region with your population and figuring out what's the right tool in which to access that. And I think some jurisdictions, I'm from BC, and we've been fortunate to have an investment in testing, which has allowed that kind of examination to take place and to look carefully at innovative approaches. And I know that certainly if other regions probably had that same opportunity, they'd be doing the same. So I think it is really multiple, that's related to funding, it's related to just availability of health services, it's about how health systems are able to implement and scale up innovation. So yeah, there's not, I think, one single reason, but multiple factors. So HIV and hepatitis C testing are critical to the response to these infections in Canada, well, everywhere. Really, unless you know your status, you're not able to progress on the next stages of the cascades of care for both HIV and hepatitis C. And we know that that has profound benefit for the individual in terms of getting access to appropriate treatment. It has better clinical outcomes, and clearly is important to get on that pathway as soon as possible after diagnosis. But we also know that it's critical to the public health or population benefits that come from a diagnosis, both then in terms of being able to know your status and change behaviors or take measures to reduce your risk of transmission to others, as well as the benefits, for example, of getting cure for hepatitis C or being suppressed on HIV, and thereby again sort of helping to interrupt those chains of transmission. So at least I have experience working in 2 provinces, and I know that there are similarities and differences in the testing systems, right? And I think it's not just about, are there clinics available? It's all facets of the system, right? Including whether tests are conducted centrally or locally, in terms of funding available, in terms of willingness to innovate, in terms of how health services are delivered. There's so many differences, but I think they do really, and they all play a difference. I think one of the things that I've seen in my work, or the things that I've been involved in, is that actually to really make a difference in testing and trying new approaches requires sort of equal commitment from multiple partners. That it's not something a community organization can easily do on its own. It's also not something that a public health division can do on its own. And it requires that clear collaboration between lab partners, between public health clinicians, community organizations, and then also researchers. And really, it really takes all of those sectors to really take advantage of new approaches and to scale them up. I'm a big believer in trying to find ways to make testing more convenient and testing easier to access, and also in ways that give people control over their own testing. Because I think part of the barriers have been sort of a reluctance on the part of providers or systems to lose control over the testing encounter. And so for me, I think approaches such as self-testing or online testing like Get Checked Online we have in BC are really ways of helping individuals to have more control over how and when they choose to get tested in an environment that they are choosing on their own. And so as sort of the providers of those services, we just have to think carefully about how do we support people when they're using those tools and make sure that we provide the resources as best we can for those individuals, and looking how they can then be connected to care.